Our first speaker is one such person, Richard Alvarez. Again, some of you have already know him. He's President and Chief Executive Officer of Canada Health Infoway. He has established a strong collaborative relationship between federal, provincial, and territorial governments and other stakeholders to create electronic health records in Canada. On the international front, he has developed positioned Canada as a world leader in healthcare renewal. He recently earned the Institute of Corporate Directors certification at the Rotman School of Management, very prestigious award. In 2007, he was recognized as the National Builder Inductee to the Canadian Information Productivity Awards Hall of Fame. For leadership he has exercised throughout his career with the Government of Alberta and then the Canadian Institute for Health Information and Infoway in promoting the application of innovative technology to improve healthcare delivery for Canadians. Now, you have the rest of his bio, but Richard has been an innovator. He has worked hard to create electronic health records across Canada, which is seamless and easy to use. And he's going to tell you a little bit about his journey and his challenges and where he sees the future of electronic health records in Canada. Richard?
Thank you, Dr. Anvani and Anvari, and good morning, ladies and gentlemen. I must say that I was going to start by saying I'm delighted to be up here this morning. Quite frankly, I'd rather be playing golf across the road. But, you know, like Dr. Hogan there and like a whole bunch of us who are on speaking circuits, Dr. Anvari, we get lots of speaking engagements and people want us to speak around the world. And sometimes we're somewhat busy and distracted, and we're not always paying attention to what these opportunities are. And this was one of those opportunities. I've got to tell you that this was, I don't know, it was still cold, so it was sometime probably in February or March. Somebody came in and said, you know, they'd like you to speak at this conference. And I didn't hear much. I heard imagination, and that caught my imagination. And then, and I said, well, where is it and when is it? And they said, July at Deerhurst. I said, I'm on. I didn't ask anything else. I said, I'm on. Whatever it is, I'm going to be there. Because there's a golf course over there that I can play terrific. It was only in the last week that actually I started to look at and see what this was about, this opportunity. And immediately I was somewhat really intimidated, you know. The fact that there were going to be all these extraordinary bright people, and there was going to be all these engineers here, and there was going to be all these docs and all these surgeons, and you know, as a sort of a health administrator, you're always intimidated by surgeons for sure, which will open up with a story about, and I'll tell you why. It's not only in this life; it's in the afterlife as well. There's these three people who went to the pearly gates, and they were met by St. Peter. And the first person came forward, and St. Peter said, look, before I let you in here, I've got to know what you did in life. Was it of any use? How did you improve conditions for mankind? And to quote yourself in one of your letters. And so the individual said, I'm an orthopedic surgeon. So Peter said, well, what does that mean? Well, see, I've worked with the aged, fixed their hips, fixed their knees, and they've gone on and lived terrific quality lives. St. Peter said, that's terrific. Why don't you come in? So the next person comes up, and St. Peter said, and who are you? And she said, I'm a pediatric surgeon. So Peter said, what does that mean? So, well, you know, sometimes there are sick babies and sick kids, and I work with them, I heal them, they go on to live very normal lives. And St. Peter said, that's fantastic. Come on into heaven. And then the last guy came up, and he was one of my lot, and St. Peter said, who are you? He said, I'm a health administrator. So St. Peter said, a health administrator. So what have you done to improve conditions? And he said, well, I run the most efficient hospital in Ontario. Actually, it may be the most efficient hospital in the world. St. Peter said, well, what does efficiency mean? He said, well, it's a matter of length of stay. He says, that's how we measure things in length of stay. He says, I can guarantee you that on average, none of our patients stay more than 2.3 days. So he said, really? But some of these people are really ill. What do you do with them after 2.3 days? He said, oh, we just throw them out into the community. So St. Peter said, okay, I'll tell you what. He said, why don't you come into heaven for 2.3 days, and after that, you can go to hell. So that's why I'm always intimidated when I hear there's surgeons in the room. I'm going to start with can you play that video with the surgeon, and we'll go from there.
Innovations are, we have a provincial program, and we're on contract. We have an electronic medical record. On my little stick here, I have access to every detail on all of my patients. All my hospital data is transferred in here. All of my chart works here. We do this telethoracic, and we have a nurse practitioner. So those are the innovations that are working for us. Our patients rate the experience at 5.9 out of 6. They love it. They love it because it saves them travel. And the distances are extensive to travel in this province. We always have winter, we always have mountains and hills. Roads are icy and slippery, and distances are far. And I remember seeing a young woman in her late 30s who needed radical surgery following radiation and chemotherapy, and it was a very tense discussion. And she was in Nelson and I was in Kelowna. And, you know, after 2 or 3 minutes, the screen becomes invisible. You're just right with the patient. On the telemedicine, I've got the family on the other side, I've got the patient on the other side, but I've got a nurse on the other side, and the patients love having the nurses there. So we're able to navigate that in a way that amazes me.
So what you've just seen, quite frankly, he used the word innovation, but quite frankly, it's pretty ho-hum technology, given the kind of stuff that many of you are into. But it's bringing together that level of technology, getting over that curve when you just saw the path to innovation, so that it's used in a way that is now actually benefiting the patients. And there you've got a clinician who's very comfortable, obviously, with that technology. A clinician, I suspect, who didn't learn any of that stuff when he was going through med school, but has had to adapt his workflow, his thought processes, etc., so that it can benefit patients who he can't travel to meet. And the question is that this technology has been around for ages. I mean, there isn't an industry in the world today, banking, financial industries, retail, that could survive without information technology. And yet, healthcare continues in many cases to be a bit in the dark ages. In fact, and why is that? Well, some of you may know Don Berwick. Don Berwick was the guru in the US. He headed up the Institute for Health Improvement and the Quality Improvements. He now runs, he's in Washington, he now runs the whole Medicare system. And Berwick says it's better for everyone when healthcare IT is used meaningfully. The question is, if it's so good, why aren't we there yet? For everybody, for all the patients, not just the lucky ones in a modernized system. The reason is because it's hard. Moving from paper legacy systems to modern IT is a big change. New hardware, new skills, new attitudes, new assumptions. It really is a new culture, and you don't get there in one step. Now, a little while ago, actually almost 10 years ago, our first ministers, the Prime Minister at the time and the premiers, decided to take that one step. And they took the one step. It was a bit of a leap of faith, based on the fact that to sustain our healthcare system over time, we've got to do something about improving the quality. There's been many studies that show that, in fact, because of adverse drugs, because of incorrect fluid injections, we actually kill between 9,000 and 23,000 Canadians a year. and